my home. It is home to 40% of our residents are immigrants. And today those residents, those families are living in constant fear. At the hands of this administration, a fundamentally broken immigration system has truly been weaponized. On Wednesday, we heard heartbreaking testimony from Yasmin, a mother from Guatemala, who lost her 19-month-old baby girl, Marie, after pleading with ICE officials to provide her baby with adequate medical care and medicine. I have no shortage of fury for this injustice, this tragedy, this callousness. But in the time allotted to me as a member of Congress, I would instead like to focus on trying to save a life. Mr. Homan, I agree with you. There has been much too much death. So in that vein, I want to enlist your partnership in saving a life. Right now, ICE is depriving an asylum seeker, Mariana, of adequate medical care. Mariana fled state-sponsored gender-based violence in Angola and is being held in Laredo, Texas at a facility operated by Core Civic, a private for-profit detention facility. Her 5- and 7-year-old babies were separated from her and sent thousands of miles away to Chicago. A doctor at the detention center said she is at risk for a hysterectomy if she is not released and receive the proper medical attention. Despite notifying detention center staff of her serious health condition, they refused to grant her access to adequate care. Earlier this week, Mariana lost consciousness. Her lawyers and her family are desperate to get her medical care. So, Mr. Homan, in your expert view, can you instruct and advise me how to elevate Mariana's case and ensure that she gets the medical care she needs?
Well, on your first comment about the callousness of ICE Medical, let me be clear in that case that was talked about yesterday, because I remember that case. In 20 days of detainment, they had 10 medical appointments, 10. And the mother didn't go to 2 of them.
I'd like
10, no.
Mr. Homan, I'd like to reclaim, this is my time, I'd like to reclaim my time, and right now.
You can't make a statement about callousness and medical care.
As tragic as, but we can all agree that it was a tragedy that that baby died, okay? I'm not talking about the past, I'm talking about the present, and we have an opportunity to save a life. And I'm asking you, in your expert opinion, what should be done and how can we elevate?
I am not going to let your comment about callousness stand without a response. This is about transparency in the American people, is it not? I'm telling you that mother is given 10 medical appointments, and she, as required by law, should release after 20 days.
Hold up. Wait a minute. Let me make sure I understand what's going on here. We're talking about 2 cases, is that right?
Yes, I was referencing the tragedy of a baby that we've already lost.
Right.
There is a woman in care right now.
You're inquiring about that? Okay, that's what I just want to make sure I was clear.
And I'm just seeking his expert counsel on what is the procedure and what can be done to elevate this woman's case, to get her the medical attention that the detention doctors have said are essential to keeping her healthy and alive.
Very well. Let me just ask you real quick. And tell us what you can do, too, to help in that situation. Now we'll restart your time. All right, go ahead. Sir.
But to make a statement about a baby that didn't die in ICE custody,
reclaiming my time. Let me state the question again.
Is this hearing for transparency to American people or not?
Mr. Homan, I am not revisiting the past.
Of course not.
I offered it for context, and I said it was a tragedy, and we can all agree there have been far too many tragedies. You said there's been a lot of death. Let's stop the death.
You can't blame the first death on ICE.
We have an opportunity to save a woman's life. You are an expert.
Contact acting ICE Director Matt Elbitz.
Reclaiming the time, in your expert opinion, where a person loses consciousnness in custody and has been separated from her babies for months, how does a member of the United States Congress get an answer about her case from ICE?
I would make an urgent phone call if that's what your facts are accurate. I would make an urgent phone call to Acting Director Matt Elbitz. ICE spends nearly $500 million on medical care in our facilities. So I'm sure all the facts you presented probably aren't the facts.
Reclaiming my time, Ms. Costello, in your view, what does it take to elevate a case to ensure a woman who is detained receives medical care?
So obviously, you can contact my office and issue a complaint through a hotline. You can send a letter to us. But as Mr. Homan is suggesting...
Reclaiming, how does your office inspect facilities to ensure the detained individuals have access to healthcare specialists and outside care?
We do periodic unannounced inspections of both CBP and ICE facilities and compare the situations we observe against either the TED standards or the PBEN standards for ICE facilities. And when we identify issues of grave concern, we report on them and we notify ICE as part of that process.
And since September 2018, at least 7 immigrant children have died while or after being in federal immigration custody. Ms. Costello, based on what your office has seen and reported on, do you have any concerns that the conditions in detention centers at the border could lead to more deaths?
The gentlelady's time has expired, but you may answer the question. Go ahead.
Based on what we reported in our management alerts and what I testified to today, we are gravely concerned about the conditions that we see in the CBP facilities at the border. And we are concerned that it could lead to additional security incidents and obviously high risk of disease.
Thank you very much. Mr. Homan, I can't sit here as a member of Congress and hear about somebody possibly dying and not do what I can to save them. And I think we all feel the same way on both sides of the aisle. I would just say I'm not knocking you. I'm glad that you have agreed, and as soon as this hearing is over, to make that phone call, because we do want to save every life that we possibly can.
If you can provide me the information, I'll make the phone call.
Her staff will get it to you before you get, before we leave.
Am I the reason you get stoned every week now? Build up integrity, got you texting, emailing me, wanting me to feel with you. Baby, just face reality, move on.
Sometimes it's hard to face reality.